prepared, but I'm kind of going to forego that because I know it's been a really long day. You guys have been amazing. And I just want to thank each and every one of you for being here today and coming together. I think one of the big sort of objectives of this meeting for us was to really bring the community together, right? To bring the families together, bring the researchers together, bring the clinicians together, to have conversations about what's important to us. And at the end of the day, the most important people here are you. So thank you for your attention. It's been a long day. Can everyone hear me okay? As a Duchenne mom, you meet lots of families, and obviously working with Jesse's journey, I've had the opportunity to meet lots of families, and having the opportunity to meet all of you today. I haven't had a chance to talk to everybody here today, but I hope that we do get a chance to all speak at some point. But the one thing that is evident to me every single time, and it just inspires me and impresses me every single time, is just how strong, how resilient you all are, right? And we all have our own story, right? We all have our own experience depending on where we are on this journey. But most importantly, we all have something very important in common, and that's to fight for our boys and our girls, because there are girls with Duchenne too. And part of what Jesse's journey wants to do, or we're starting to do and get more involved in, is through the advocacy movement. And we can't do this alone. We have to do this together. And we each have our own voice, and collectively together we are really powerful. And we want to harness that power and really start to make some changes for this community. And we've already started to do that. And one of the things that Jesse's journey has done was we did a survey this summer. So I don't know, hopefully some of you had a chance to participate in the survey. And if you didn't, don't worry, because we are going to be doing another phase next year. But in order for us to advocate on your behalf, if we as an organization are going to represent your voice, we need to hear your voice. We need to get your input. And so these patient surveys are really critical and an opportunity for us to gain that information, to gain that data so that we can go forth and advocate for you, because that's what we're doing. And so I just want to share with you some of the things that we have done. So this survey that we ran over the summer gave us an opportunity to gain some really important information. One, we were able to describe what the Canadian Duchenne population looks like. We were able to gather information about what's important to you. What are your needs? And that's going to be different depending on where you are on this journey, right? And so we need to understand that, and we need to quantify that for the government agencies that we're going to be advocating to. And that's what we were able to do. We also asked individuals about what their risk preferences were for new treatments, which is a really important piece to communicate as well. And we ran the survey over a 2-week period over the summer, and we ended up with 77 respondents. So 77 people responded to our survey, and these were individuals with DMD, they were caregivers and parents of DMD. So we were pleasantly surprised and also thrilled to be able to put this information together. What we did with this information is number one is we put together a summary, which we are planning to publish. So we will get to share that information back to you at some point in a publication in the new year. All of the information that you provide is anonymized, okay? So we're talking high-level, broad information. It can't be identified back to you personally. We put together a summary and a letter, and we submitted that letter to Health Canada for a new drug submission. This is the first time ever a patient organization has submitted or put forth a patient submission. The way that our procedures here in Canada are, with Health Canada specifically, is right now our government agencies are making decisions about what drugs are beneficial and safe for us on our behalf. So without actually consulting the patients and the families who are going to be taking these treatments, right?
We're the ones that are going to be experiencing those benefits, and we're the ones that are going to be taking those risks, and yet we don't get a say in any of this. And so we have taken the first step forward where we actually sent it into Health Canada and said, you need to hear what it means to us to live with this disease in Canada. And we did that. And we were successful at that because when we spoke to Health Canada, they did take that into consideration, and it was presented to the review committee during a new drug submission. There are currently no treatments available in Canada for Duchenne. There are treatments available in the US, there are treatments available in the UK, but there are no treatments currently available in Canada, and that's a problem, right? Every single one of us here, and I think the gentleman over here mentioned that earlier too, is that, you know, time is not on our side. So we can't sit by and wait for government policies to change, because that takes a lot of time. And right now in Canada, there's no rare disease policy. There's no mechanism for us to, one, have input into any of these processes, and how do we get quick access to these treatments? And those are the things that we are fighting for and advocating for today. And we're going to do that with your help, because we need your help to do this as well. So we also ran a town hall. I don't know if anyone had an opportunity to go online. There was a town hall that went live in Ottawa in September. It was live on Facebook, and this was an opportunity for us to bring some leaders together from the rare disease community. So we had CORD present, the Canadian Organization of Rare Diseases. We had a clinical trial expert, director of clinical trials at the Hospital for Sick Kids. We had a mother, well, we had a couple mothers. We even had Eric Morton, a patient, who sat on this panel. And we talked about some very key issues and discussions around the challenges of the new drug authorization procedure. We talked about what we can learn from other jurisdictions like the US and the UK. And we talked about how our systems can be amended to provide better access to those of us living with disease. And for Duchenne, I take that a step further and say we need that now. We can't wait. We need it now. And so following this meeting, we went and we met with Health Canada. And so when I say we, our patient organization, so the Duchenne patient organization, so Jesse's Journey, Stand for Duchenne, and La Force DMD, the three of us have come together collectively, and we have built a mandate. And that mandate is around getting faster access to treatments for boys in Duchenne in Canada. And the three groups set up this meeting with Health Canada October the 2nd, and there were 4 individuals from Health Canada that sat there with us. 4 senior executive directors of Health Canada sat at the table with us. Our meeting was supposed to be an hour. They sat with us for 2.5 hours. And during that 2.5 hours, I presented the results from our survey. So they listened to us as I shared our voice about what it means to live with Duchenne in this country. I shared with them what are our priorities, what's important to us. And we shared, most importantly, what we need. And that's immediate access to drugs in Canada. And we've asked them to, take into consideration what's happened in other jurisdictions. The fact that these drugs have been approved elsewhere. They're reviewing the same data. So why is it not here? Duchenne is Duchenne. Doesn't matter where you live in this country. Doesn't matter where you live in, which province you live in, or which country you live in. Duchenne is Duchenne. So why should you have different access to a drug based on where you live? It's not right, right? So we are advocating to get the need for immediate approval of these treatments. And we didn't just go in there and ask for that. We didn't just go in there and say we need approval of treatments today. We went in there with some solutions. We did our work, we did our research. We learned about what's happening in the US and the UK, and we said, here are some places where they have been successful at doing this. Why are we not doing this in Canada? Right? Patient input is the key to this. And the ability to even be able to provide that input is key and important. So we need to start doing that in Canada, and this is how we propose you do it. And they listened to us, and they agreed. They said, absolutely, we need to change this, and absolutely, we need to do this. And our job is to make sure that this happens, but it happens now, right? Not tomorrow, not next week, not next month, but now. It's not to say it's going to happen now, but we're going to keep beating down that door until it happens, and that's our goal, and that's our commitment to you. But again, in order for us to do this, we're going to need your help to do this. We talked about some of the tools that we've used, and so I'm talking about on the healthcare side what we've been doing, and there's a lot of activity that's been going on the political side as well, and Joanne mentioned the advocacy hub, which again, easy to use, and that is something that you can do individually. Very easy, go online, send a letter to your local MP or MPP. You can even take it a step farther, you can go and meet with them and have a discussion, and if you really want to do that, fantastic, and if you want help doing that, call me, call us, call Jesse's Journey, we will help you to do that. So I'm now talking about how you can get involved. So the key, so step one is, and I get it, I mean, you know, we deal with a lot. We've got our kids in clinical trials, we're dealing with the clinical care of our kids, there's a lot of stuff that we're dealing with. So last thing we need to do is deal with this too. And this is why Jesse's Journey is here, because we want to do this on your behalf. If you want to do this individually, fantastic, because the more people doing this, the better. If you don't want to do it, that's okay too, because we're happy to do that on your behalf, but we still want your input. We still want to understand what's important to you and what you need, and we're happy to go out there and do it for you. The registries are key. Registries are really important. If you get a chance to participate in a registry, please do, because that's an opportunity for us to collect data. The patient surveys are going to be important, and I know this is going to be another paperwork. I mean, we have a term for it at home. It's called, we have paperwork fatigue. We get that quite a bit, especially when you're in clinical trials. A lot of paperwork you got to go through, and you finally go, God, I got to send another form. I'm going to go crazy. But if we don't get this information from you, then it makes it really difficult for us to advocate on your behalf. And so if you get a chance to fill out those surveys, please do. I mentioned we have a phase 2 for our survey that we're going to be doing next year. So we're going to improve upon what we did this year and hopefully have it open for a much longer period of time, so you'll have another opportunity to participate in them. We talked about the e-hub and meeting with your MP. But I mean, the other thing too is if you really want to get more involved, and I know a lot of you are doing a lot in your local communities, and it's fantastic. It's so amazing the work that you guys are doing. And if you want to do more, let us know, right? Rochelle, it's right here. You know, contact Rochelle if you want to volunteer with Jesse's Journey. If you want to be a champion, a family champion, we are looking for family champions in every province, in every town, in every city. As many as we can get. The more champions we have, the better. And we want your input, right? We want you to tell us what we need to do on your behalf, because we're here for you. And in order for us to do that, we need to hear from you. So I would love to hear from you about what you want to work on. If there's something you want to do in your local community and that we can help you in some way, we would love to do that. So please let us know. And you've got our team. I mentioned Rochelle, we've got Rick, we've got Carrie. So we're here to help you. So on that, thank you. Questions? Yes?
So do you guys have it set up, so you said family champion, do you have like communities within cities or like Justice Journey, or how does that work? Or is it just individuals that support organizations throughout Canada? What is that structure?
So this is for Duchenne. So we're looking for Duchenne family champions. This is a brand new concept for us. So we will make this whatever you want to make it. Let's have a conversation about what that looks like and what that does. I mean, one of the things is, for example, programs like this, and we're going to continue to do programs like this. We want to get your feedback on what would you like to see in these types of programs. What's going to be useful to you, right? Do you want to sit and listen to the research that's going on? Do you want to hear different types of information? Do you want to get involved in different types of ways? This is the stuff that we want to hear. The other thing we're working on actually is a 2-day conference. And we're still deciding on when this is going to happen, but it's going to be a 2-day conference. One day is going to be for medical research community, and the second day is going to be for families. It's going to be a national meeting, so we're going to be inviting families from all across the country. This is going to be the first time that there will be a Canadian Duchenne specific conference. And my goal for this is to bring together the medical, the research, and the families together, right? Because we're all in this together. I mean, right now is such a hopeful time for the Duchenne community. I mean, we've spent the day listening to some really, really smart, really motivated individuals that are working on some really great research, right? And there's a lot more that's going on. And there's a lot of money, there's a lot of resourcing right now that's going into Duchenne research. This is a really exciting time for us and our families. We should be feeling very hopeful right now for what the future holds. And if those treatments proven to be beneficial and safe for our children, then it's up to us to make sure that we get access to these drugs as quickly as possible, right? That's our job, is to make sure that we can get access to these drugs, because all of this is going on because of us, because of our boys and girls, right? And so these aren't going to do us any good if we can't get access to this. And we don't have time. Our boys and girls don't have time. We can't wait years for these things to come. So we need to really find solutions that are going to help to expedite and speed this up so we can get access to these things. And that's what we're here to do. And I mean, we're just starting out on this, right? So there's a lot of expertise in this room. I've met families, expertise from all over. I mean, I come from the pharma industry, right? I led the medical team for spinal muscular atrophy for Biogen, right? So I have a certain expertise that I can bring, and skill set that I can bring to our community to help us get there. There are so many other individuals here that have a expertise, so if you do and you can help, then please, let's do this together.
Will you have the participation of Health Canada at the 2-day conference?
Absolutely. Fully plan on inviting Health Canada, CADA, so our HCA organizations. These are the individuals who make this decision as to whether or not they're going to fund those therapies. We're going to invite political leaders as well. Absolutely, we're going to invite them all. And again, for family champions, if you want to be a family champion, we want to develop a steering committee of families. They're going to help us build out the agenda for this conference. And advocacy is definitely going to be a topic there for sure.
And that was Nicola.
And this is Rick.
We are fortunate to have it. We just